13, live.
To me, basically a death sentence.
How much is a life worth? Access, Arizona's healthcare cost containment system, is slashing life-saving coverage for tens of thousands of people. Good evening, and thanks for watching KOLD News 13 live at 6. I'm Dan Mares.
And I'm Heather Rose. State lawmakers ordered the cuts, and Arizonans will certainly feel the pain from head to toe. Starting tomorrow, Arizona's version of Medicaid no longer covers most dental care for adults, and lung transplants, pancreas transplants, and some heart transplants are also dropped for anyone over 21.
Same goes for microprocessor-controlled prosthetic legs and for foot and ankle care done by podiatrists. The cuts are potentially devastating for people with diseases as different as cancer and diabetes.
KOLD News 13's Barbara Grijalva live at University Medical Center with the story new at 6 tonight. Barb?
Well, you know, Arizona's recession has put a lot more of us on access. That's, of course, the Arizona's healthcare system for the poor. But at the same time, the state is experiencing a budget crisis. Now, it could be just a lot of numbers, but legislative cost-cutting has a human toll. In fact, doctors here at UMC are telling me that Arizonans will die because their treatments are being slashed from the budget.
I want to understand that we're people, we're human beings.
Manny Cáceres says he and many others have been handed a death sentence. He needs a heart transplant. He's so sick he can't work anymore. But now Arizona's health care plan for the poor will no longer pay for the transplant that will keep him alive.
I've been on a transplant list for 2.5 years. Now I'm up. You know, and there's really not much I can do.
Transplant specialists in Tucson say there already is a national outcry about what's happening in Arizona.
The solution that we currently have is discriminatory against certain groups of patients.
Dr. Gruessner says the state never consulted Arizona transplant specialists about the cuts. They do have a way to cut costs without condemning patients to death. They would cut out some diagnostic tests. Not ideal, but...
And by doing so, we still would be able to transplant the patients that are currently being considered for being eliminated.
But nobody bothered to ask Dr. Gruessner and his colleagues. Another budget cut. Patients, even those with diabetes, will no longer be allowed to see a podiatrist to prevent foot sores that can lead to amputation.
In this case, prevention really does pay. And the most common reason that people with diabetes will end up in hospital is not for high blood sugar or a heart attack or a stroke, it's for their foot.
Consider $75 to $100 for a once-a-year visit with a podiatrist that can prevent a dangerous diabetic foot sore versus amputation, which can cost up to $100,000. And there's the human cost.
When a person with diabetes loses their leg, half of these patients are dead in 5 years.
Human cost. There's no line for that in the budget.
Just not being able to see my grandkids grow up.
Doctors already know the human cost of denying transplants. Dr. Gruessner says up to 35 Arizonans will die each year because of the new regulations. Dr. Armstrong says an annual visit with a podiatrist actually reduces the risk of amputation by upwards of 2/3. Reporting live from University Medical Center, Barbara Grijalva, KOLD News 13, live, locally breaking.
A devastating and really overwhelming situation in reality. Thanks so much, Barb.